pleasure to introduce you to Steve Tristram. I've known Steve since 1995, I think it was, when I first met you, Steve. And at that time, you were already using duplex ultrasound routinely in the assessment of people with varicose veins and the complications of superficial vein reflux. And I was really impressed, because you must have been one of the pioneers of the routine use of duplex. And I have learnt a lot from you. I'm sorry, I don't wish to embarrass you, but you really have been a pioneer in the assessment and treatment of superficial vein reflux and varicose veins. I know that you've been the Associate Vascular Specialist at Basingstoke since 1976, and that you've run the varicose vein clinic and the leg ulcer service there in the NHS for years. So you've obviously got an enormous amount of clinical experience, and I've learned a lot from you. So thank you very much. And I'm hoping that our discussion today will cover topics that will be of interest to members of the public who are perhaps worrying about their veins, worrying about the possibility of a complication developing, and there's lockdown, they obviously can't access, or they don't want to bother their GP practice. I don't know, I suspect you're getting quite a lot of inquiries. In fact, you're probably still running your NHS practice at the moment remotely, are you, Steve?
Remotely only. I don't go into the hospital. Well, it's not true. I go in occasionally, I sign letters, and but the hospital set me up at home to have all the information I need, letters, blood tests, scans, etc. So I can mostly help people pretty well. The odd one, which has been difficult, people who've had a bleed from a vein, you feel like you want to see them straight away, because that's what we normally do. We offer an immediate access service. And I'm actually going into the hospital tomorrow to talk about whether that could be introduced safely and professionally in the environment we're in. So that's the only ones that are particularly urgent. The community nurses in this area are very good. I know almost all of them by first name terms, so I'm able to advise them pretty closely. And of course, that's where photography plays a huge part. So.
I'd be interested in your view, Steve. I mean, in my mind, I tend to classify people that I see with veins into one of three groups. There's a group for whom the main motivation for requesting treatment is the appearance of their veins. Then there's another group for whom they're not too concerned about the appearance, but they're getting a lot of symptoms and they're finding that quite troublesome. And then the third group, which is probably the group which is worrying at this time, is the group in whom they either have had a complication such as phlebitis or varicosectomy or leg ulcer, or people who think they are developing a complication like that and they really feel that they need some help and advice. Would that be your broad classification system as well? Do you think that's reasonable?
Yes. By and large, I think I do get communications as well from GPs, advising what would be the way forward, particularly in terms of access to our service. But I think that's pretty largely the case. And I would say very few of the calls I've been getting are of a cosmetic basis, because they mostly understand the situation.
Yes.
A lot of them have seen me in the past and know me very well. So I think it's the people with symptoms, as you've said, either that of skin changes, skin irritation, just swelling, particularly swelling. That concerns people a lot. Somebody gets a swelling and discomfort in the leg. Do they have a DVT, etc.?
Yes.
I had two people who definitely had an early cellulitis, which is where the leg was painful and red. And in fact, what we did on both of them is, again, I got them to demarcate the edge of the area, the felt tip, and we followed it over 3 days when they got antibiotics from the pharmacy, which I phoned, and in fact, all of them have so far improved. So
that's good.
The commonest thing I hear about is people with discomfort, with tenderness, with skin changes, particularly injuries. About 2 people this week phoned because they've knocked their legs in their garden and have got flap injuries, and that's quite difficult to deal with, and they really do not want to go to hospital. So advising people like that is I think that's really quite useful.
Okay. So Just so that we can perhaps draw a line under people who are concerned about the appearance. I mean, it's obviously, if they've got spider veins or they've got varicose veins that are not causing any symptoms, these are things that I'm afraid we'll just have to wait until the end of the lockdown. Even if they want to see somebody privately, that's just not possible at the moment. Is there anything that you think they can do to minimize the risks of progression, or do you think it's just a question of waiting and seeing a specialist at the end of the lockdown?
Well, okay, my answer to that is we don't really know, but I think one of the things is that probably on simple cosmetic appearances, I doubt if there's very much they can do apart from continuing good skincare. I don't think that wearing a good compression hosiery probably makes a lot of difference to the cosmetic end of veins unless they're symptomatic. I think though that good skincare, good moisturizing definitely helps because that reduces the risk of skin breaking.
Yeah.
If you've got little clumps around ankles, etc., everybody should be using moisturizer around their ankles, really from the age of 50 upwards, if not earlier.
Yes, that's good advice. And of course, in the summer, our legs tend to get drier, don't they, because of the effects of having your legs exposed, and perhaps the use of soaps and detergents and so forth. So moisturizing is very important.
Especially if you live in a hard water area, that's even more important, such as where I live. So
yes. So let's draw a line under the appearance side of things. For symptomatic veins, let's say somebody's getting a lot of symptoms from their varicose veins and their superficial venous reflux. The weather's getting warmer. Regrettably, it's a time when heat and the weather makes your legs worse. It tends to aggravate the symptoms of varicose veins. What should people be doing to relieve their symptoms?
okay, well, I think it's worth going into a little bit of detail as about the symptoms they're getting. Is it just generally aching? Are they feeling heavy? Are they feeling itchy? I think those sort of veins where in the absence of any signs of more serious issues, and I think the question I always ask is, how far can you walk? And if there is a restriction, is it because of your legs hurting or is it because you're breathless or otherwise? So it's worth becoming a bit specific as to rule out this issue of serious circulation, serious arterial disease. I think otherwise, if they've got a good walking distance, they're reasonably fit, and I think again the use of moisturizers is really important. But that's really where advice regarding compression hosiery becomes much more important, and that's an area where it's really worth understanding what you're trying to achieve, but it's a little bit more complicated than saying just wear stockings.
Right. Now, do you think people who have varicose veins, perhaps they haven't seen you or I, and they haven't been advised about compression hosiery and how it works, they probably haven't been measured. Do you think these people should go online and access compression hosiery themselves, or do you think they need to be fully assessed by a vein specialist before they even consider medical grade compression?
Well, I think in the perfect world, an accurate assessment is important, particularly to exclude serious arterial disease. But the very simple question of getting walking distance is a good way of answering it. And also, most practice and community nurses are now very experienced in Doppler assessments, etc.
Yeah.
The problem will be accessing that, because that will be considered fairly low importance in terms of the criteria and priority at the moment.
Yeah.
I think it's important to say all forms of compression hosiery are generally a compromise. So, the perfect compression stocking it doesn't really exist, because most people would not be able to apply them correctly, even if they could obtain them. So I think what you do is say, as long as you're not getting a stocking that's too tight, as long as it doesn't leave a garter mark, whether that's below the knee, if it's a calf-length stocking, or in the thigh, then I think by and large that stocking is probably safe.
Yeah.
I tend to say to people, the perfect stocking generally would be a full-length stocking, but there's no doubt that calf-length stockings are much easier to apply. They're much more comfortable. As soon as you put a stocking on or a garment that goes over the knee, you get into a different territory. So by and large, going for calf-length hosiery of a reasonable make, and there are some very good websites. Pharmacies nowadays, they're definitely improving their stock. It used to be the cheapest possible health service tariff stocking. They're now much better. Certainly the bigger ones around here are. So
yes. I'm not promoting any particular website or any particular make, but I know that, for example, a lot of people go online. They look at, for example, Amazon. There's other smaller distributors, and of course there's the UK's largest, which is Daylong, and people can go along and get the low compression hosiery, medical grade in the sense that it's graduated, it's firmer at the ankle and less firm as you go up the leg, but it's lower compression. And I know that a lot of these websites will sell directly to the public if it's low compression, around 15 to 20 millimeters of mercury pressure at the ankle.
That's what I recommend as well.
Yes, yeah. Do you think that's reasonably safe in the absence of seeing somebody? For example, if we were to have an inquiry from someone we haven't met physically, we've done a virtual consultation, perhaps on the telephone, the patient is young, under 50, nothing to suggest an arterial problem. They say they've got big bunches of veins and their symptoms sound venous. Do you think it's reasonable for them to self-measure and buy a pair of 15 to 20 calf length?
I think so. I think you give them some provisos of saying if it's making your symptoms worse,
yes,
as I've said already, if it's causing any form of garter mark,
yes,
either just above the ankle, if it's too tight at the ankle, or just below the knee, and providing they're comfortable. I think that's it. And if their symptoms improve, then you know you're on a safe wicket, I think.
yes.
If their symptoms are worsening, particularly if they're getting more discomfort on walking, etc., then they've got to be warned that that's a sign that they may not necessarily be doing the right thing.
Right. Well, that's great. Thank you very much, Steve. That's something that I agree with as well. I find that erring on the side of low compression and making sure that the symptoms are improved, that seems to be a safe approach, even for people that you haven't met. Now, so that's taken care of two of the main groups, which are the ones who are concerned about the appearance, the ones who've got symptoms. What about those who might be suffering from one of these complications, such as superficial vein thrombosis, varicose eczema, or skin changes, perhaps is a better term, and leg ulcer? Now, let's say I've had a lady who contacted me via the website contact form. I haven't seen her. She says that she's got these changes in her skin that she's had for a long time. It's becoming painful, and she thinks she's developing an ulcer. I haven't met her. I haven't had the chance to assess her, and she's just looking for some advice. Now, what do you think might be a safe approach for somebody who's worried about phlebitis, worried about skin changes, or worried about the possibility of an ulcer? Do you make a distinction between those three groups? Is there anything we can do remotely, or do these people need to phone 111 and access the health service urgently? What's your view?
Okay, well, you've got three separate areas where there's issues. The first is phlebitis.
Yes.
Phlebitis, you know, is an inflammation of a superficial vein, which generally produces localized tenderness, often a redness along the alignment of the vein, and it can be extremely painful, as you know. Now, the crucial thing of that is to a very strong message: this is not an infection.
Yes.
And 99% of the time, it is not an infection. And still routinely, antibiotics are prescribed because it's seen as an infection, and antibiotics make no difference. It's really important. And if you go on the NHS website, they've got very good criteria for when it's possibly infection. So if you've got localized phlebitis, localized inflammation of the vein, you're not shivery, you've got no sign of generalized infection, that would be the standard type of phlebitis. And the treatment of that is three things, in my opinion. It's obtaining compression that's comfortable, anti-inflammatories, either orally, by mouth, and making sure that they don't upset you, making sure you don't have asthma, and over-the-counter anti-inflammatories like ibuprofen, and they come in different generic names, is to me and exercise. Those are the three things that help phlebitis. Unless exercise causes increase in discomfort, in which case you could consider whether elevation would help. But anti-inflammatories, orally and topically, Voltarol and ibuprofen anti-inflammatory gels are extremely effective. Very important to remember that most of those gels don't last very long once you've opened them. So after about 6 months, if they've been in the cupboard, they're probably less active than they used to be. So they need to be reasonably fresh. And I think they're very effective, and I would encourage the use of those things. So basically, exercise, anti-inflammatory, topically or by mouth, and compression hosiery is the management, would be for phlebitis. Whether you've got, your second group was people who are getting skin changes and concerned that they're getting an ulcer. Well, that's where it gets more difficult, because I think it's very important that if they're getting leakage from the wound, it is an ulcer.
Right.
If they're getting leakage from the wound for more than 14 days, by definition, it's an ulcer. So I think those people do need to access, if they can, the community side of the practice, and the general practice in my village is open and working. The nurses are there, so they are very much better at assessing those than we can be online. But so I think advising them to seek advice from a community nurse, either as a district nurse or a practice nurse, would be quite important. I think if they've actually got an ulcer that's getting worse, again, ulcers are dreadful things. And I think, again, you've got to get community advice, and that is still very definitely available at practices, most practices. And I think part of that is to include if you injure your leg. I mean, the two people I spoke to this week have both got flap injuries. One, quite a big flap around the base of the flap was 2.5 centimeters, and the distance to the top of the flap was 3 centimeters, so quite a big flap.
Yeah.
So I advise them to get some Steri-strips, and you can now buy Steri-strips over the counter. They come in, they're slightly different to the Steri-strips you and I remember from practice, from A&E days, from emergency room days, but they're very good. And I think if you can Steri-strip the skin to go back to the alignment, that would be the best advice. If it's worse than that, again, A&E departments are crying out for work, as you know. My one, thankfully, not being inundated, I think they've been amazing what they've done. And so I think, they can be used, and that's the sort of area where practice or A&E departments, if you've got an ulcer, particularly if it's worsening, be very careful of over-the-counter dressing. Some of them are not great for ulcers, and it's very important to take them seriously.
Right. Well, I think you've given me all the information I need, Steve. It's wonderful and very succinct and very clear. I think that's wonderful. Is there anything else you think we ought to talk about in terms of giving information to the public during this time?
Okay, I think it's worth just mentioning if you get a bleed from a vein.
Yes, that's right.
I think that there are things you can do. If you've never had one before and haven't been advised, then there are two things that could reduce the bleeding. One is if you can get access to putting pressure over the bleeding area, just with the finger, or if you have a clean dressing, clean handkerchief, that's fine. If you're in an area where you can't access pressure to the wound, lying down and getting your leg just above the height of your heart will stop the bleeding instantly.
Yeah.
Because you've removed the venous pressure. And I think just sometimes that's necessary. And in the ideal world, those veins need to be treated as an emergency. And certainly in my hospital practice, we on a Thursday morning have 4 slots for people who've had a bleed in the previous few days, and we inject them, occasionally put a suture through them, but mostly they're treated by injection. And we're trying to work out what we can do, because I've got 7 referrals in the last 5 weeks from GPs with bleeding veins, and I'm trying to see them tomorrow. I'm going to try and work out if I can see them in a clinic somewhere.
Oh, that's very good. So you're still working in the NHS, Steve?
Yeah. I think I might be the oldest one at the hospital, but no, I still enjoy it. And
That's great. That's wonderful.
yeah, they're all
Well,
good friends still. So.
well, I was telling my wife Jane this morning that we first met in 1995, and that you've been an associate vascular specialist at Basingstoke since 1976. So yeah, the amount of experience and wealth of information that you have is just a great resource to tap into today, Steve. It's been very kind of you. Thank you very much. I wish you and your family well. When you do get back to the NHS, I hope you remain well and that you get the sorts of PPE. This is a term now that every member of the public knows. PPE.
Yes,
We all
it
want
is.
PPE. Do you know what they might be asking you to wear when you're doing your injections for these bleeding veins?
Well, it's part of it, because I have on 2 occasions been in ITU recently, because one of my skills, and yours as well, Tarun, is
Yes.
cannulating vessels with ultrasound galliums.
Yes.
And so they know that if they're really stuck, it's something I'm blowing my trumpet, but it's something I'm very good at.
No.
And I have worn PPE, and it is dreadful.
It is dreadful.
How on earth I know they're all younger than me, but how on earth they cope with the shifts. My normal senior sister in outpatients, who's a fantastic nurse, is doing 3 12.5-hour shifts on a COVID ward.
Wow.
And wearing PPE.
Wow.
And she's lost pounds in weight because she's perspiring and things. So
Wow.
it is. I think it'll be a glove, obviously, almost certainly an apron, though I'm not really sure what that does, and it'll be some form of face wear to protect your eyes and mouth. And I think, although I don't like it, that's probably going to be what they will ask me to do.
Well,
What would you suggest?
Well, obviously, I'm in a private clinic. I run a private clinic, and we're completely closed. We're not offering the sorts of services that you are for urgent and emergency vein conditions. I had a Skype meeting with our team this morning, and we were talking about the sorts of PPE that we might need to use. For our sorts of procedure, they're not aerosol generating procedures, so we don't think we need to wear the masks that filter out all the particles of virus. And in fact, I don't think it would be appropriate. It would be an abuse of this valuable resource for people who need it in intensive care. So we're planning, when we do get back to our clinic, to wear visors, face visors, and a surgical mask, an apron and gloves. And we are also considering asking our patients to wear a surgical mask themselves when they come in and have treatment. We're also following very closely the general debate about whether we should be wearing some form of face covering out in public. I suspect that when we are allowed to go out a little bit more, and I notice the terminology is changing as well. The government's calling it the lockdown adjustment, not lockdown easing or restrictions being removed. It's an adjustment of the lockdown measures. I suspect when we're allowed out a little bit more, people will want to wear some form of face covering. There's a lot of debate about whether this is appropriate or not, but I know that Nicola Sturgeon is advising the Scottish public to wear some form of face covering. And I think that's a good idea. I think that the absence of definitive scientific evidence is not a reason not to do it. I think if we wait for all the evidence to be definitive, we might have missed an opportunity to reduce the spread.
And Nicola Sturgeon was saying in areas, particularly where there's areas of closer, on transport in busier shops, etc.
Yes.
I have bought, Joan and I have bought the light mask, and you just pull it's a cloth.
Yes.
You pull it up over your face. And I have to say, these are extremely comfortable, and they've been made by a company who specialise in in washable materials, and so these are easily washed apparently. So
Great.
I actually wore it today. I didn't go into the hospital wearing it, but actually it was remarkably comfortable, far more than a mask, because a mask is
Yeah,
tricky and itchy. So
it is. It is. Well, you'll have to send me the link, Steve.
if you're not recording, it's called VisiGuard.
VisiGuard. Okay, I am recording. We'll look it up. Thank you.
Okay,
Oh, yeah.
and it's actually it's supposed to be virus static. I'm not
Ah,
sure why. It's one of these materials. I did say to someone the other day, well, static means it stops it growing.
yeah,
It's not killing it. Sidle is the word for it. So, but they're called VisiGuard,
yes.
and I ordered two for my my daughter and son-in-law yesterday, and they're apparently coming today. They're very quick, so
Wow. Well,
£20 each.
£20 each. A bargain. A bargain. Steve.
They will last a long time. My wife's been wearing them regularly because she's the shopper,
Ah,
and I've been wearing it very much. So in shops, she wears it.
that's good. Well.